Do you suffer from simple or complex partial seizures? Do you feel like you have hit a wall when it comes to managing your chronic nerve pain? Talk to your doctor about gabapentin.
Gabapentin is also marketed as Grelise, Horizont, and Neurontin. Taken orally, it is broken down into smaller particles when it reaches the stomach. It is then absorbed in the small intestine, where it enters the bloodstream and crosses the blood-brain barrier. Inside the brain, gabapentin increases production of the neurotransmitter GABA, a nerve calming agent, and inhibits the production of glutamate, a nerve exciting agent. This alters the way neurotransmitters send messages to the brain and stabilizes electrical activity.
Prior to taking gabapentin, your doctor should assess your current seizure activity and duration. If you are taking gabapentin for neuropathic pain, discuss with your doctor the location, duration, and characteristics of your pain. Gabapentin may cause changes in eyesight, therefore an eye exam is necessary to determine a baseline before you begin taking this medication.
Patients are expected to see a reduction in the number of seizures they experience after beginning treatment. When used for pain management, patients should begin to feel improvement in the severity of their pain within 1 to 2 weeks of starting gabapentin.
Common side effects include drowsiness, confusion, depression, double vision, UTI, and rhinitis. Taking gabapentin may cause serious or life-threatening side effects such as increased frequency of seizures, suicidal ideation, leukopenia, thrombocytopenia, Stevens-Johnson syndrome, drug reaction with eosinophilia, and systemic symptoms.
Gabapentin is contraindicated with hypersensitivity. It is not recommended for pregnant women, those who think they may become pregnant, women who are breastfeeding, children under the age of 3, or geriatric patients. Those with renal disease, suicidal thoughts or depression, and patients undergoing hemodialysis should consult a doctor before taking gabapentin.
Do not cease taking this medication suddenly. Gabapentin must be weaned off slowly over a period of several weeks. Do not take this medication within 2 hours of other medications or antacids. Gabapentin may be taken with or without food, but should be taken with a full glass of water. Do not take gabapentin with other central nervous system depressants such as alcohol, sedatives, or antihistamines.
If hospitalized, nurses should monitor for therapeutic effectiveness of this drug by assessing seizure activity and safety of the patient, including vision changes, lack of concentration, impaired coordination, and changes in mood.
Those taking gabapentin should carry emergency ID stating their name, medication, dose, medical condition, and the prescriber's name and phone number. Avoid driving or engaging in other activities that require alertness. Notify your prescriber if pregnancy is planned or suspected. Do not breastfeed while taking gabapentin. Do not crush capsules. The capsules can be opened and the medication added to food for those with difficulty swallowing. If a dose is missed, take the dose as soon as possible or wait until the next dose. Do not take a double dose. If experiencing adverse effects such as allergic reaction, increased seizure frequency, visual changes, unusual bruising or bleeding, contact your healthcare provider immediately. If you want to be free to live a healthier, happier life, ask your doctor about gabapentin today.